Hello and welcome to the educational material of our protocol. The impact of knowledge translation on attitudes towards surgery among people with epilepsy, randomized clinical trial. This research is being done by Dr. Tawfiq Valianti from the Neurosurgery Department at Toronto Western Hospital. We will go through some important educational material about surgery for epilepsy. In this video, we aim to thank you for your interest in learning more about surgery and for your consent to be part of this study. As you know, surgery is an option for people with epilepsy, especially those who don't respond to multiple medications. Now, sometimes this can result in a cure of epilepsy, which is very good news, but in other times it could result in decreasing in the frequency of seizures. We know that there are many barriers that could make you less interested in this option in your management plan, even if you were found to be an excellent candidate, and this was suggested by a previous pilot study. We want to see whether information about epilepsy surgery will change how people feel about surgery, and we encourage you to watch this video to know more about this option of treatment. We will go through an introduction about surgery for epilepsy. You should know that this option has been around for over a century, but it has dramatically evolved in the last 2 decades. You have to understand that we will always weigh the benefits of the surgery and the risk associated with it. Usually, we will offer this option only if we believe that the benefits outweigh the risks. People with epilepsy are considered as possible candidates of surgery if they have difficult to control seizures that haven't responded to aggressive treatment with multiple medications. So this option will be available for you after the trial of multiple medications. Studies have shown that when surgery is considered as an early option for a good candidate, the outcomes are better. And this is why it is important to think about this option if you think you are a possible candidate for surgery. When will the option of surgery offer to you? Currently, the option of surgery is offered for people who have had uncontrolled seizures as early as 2 years after failed medication trials. You don't really have to wait and to try many medications before start thinking about surgery, because as we saw in the previous slide, the earlier the doctor and the patient decide to go for surgery, the better the results. You will be offered this option only after careful consideration, and if you had failed at least 2 single medications and a combination of 2 or more drugs. The expectations: this surgery is considered as a major neurosurgery, and you have to understand that the recovery period varies between patients, but most people can resume their normal daily activities within 2 to 8 weeks after the operation. So what you should expect after surgery? Of course, our aim is to make people with epilepsy free of seizures, but sometimes the result is having less frequency of seizures, and sometimes the frequency doesn't change. But the usual result is a reduced number of seizures, or at least less intensity of the seizures. And if we couldn't help with lowering the number of seizures per day or per month, we can at least help you lower the complexity or dosing frequency of your epilepsy medications. Sometimes the results are very good, that you could be seizure-free after the surgery and you could actually stop your medications altogether, but this usually happens after many years of being seizure-free. So there is many good news about surgery, but you have to understand that you will always be fully examined and evaluated, and you will be told about the likelihood of a freedom of seizures before making any decisions. Testing before surgery is very important because we have to weigh and balance between the benefits and risks of the surgery. Our aim is always to maximize seizure control after surgery and minimize the disruption of the normal brain function. So there are multiple types of surgery that could be done for epilepsy. Mostly, surgery for epilepsy involves resection of a certain part of your brain, which is called a resective surgery, and this part we most likely believe is the responsible for most or all of your seizures, and which we believe, if lost, won't affect your daily functions by a major way. But there is a less common type of surgery, which is about disconnecting the pathways between the different firing points of seizure activity in your brain without resecting or without the resection of the origin of the epilepsy activity. The problem with this option is it is usually palliative, not curative. So, after careful testing, we will explain what type of surgery will be offered, which will usually offer greater benefits in your long-term quality of life. And the most important thing for us is for you to have better quality of life. In the coming 2 slides, we will show you the outcomes after surgery in numbers. We will try to explain to you the common benefits and risks associated with the surgery in the following charts. This data has been gathered from important large studies in respected international journals. So, the results we are going to show are coming from one study in which half of the patients underwent immediate evaluation for surgery because of their uncontrolled epilepsy by multiple medications. The other half underwent 1 more year of trial with aggressive multi-drug management to control their seizures. The first outcome we are going to look into is the recurrence of seizures over 1 year period. In this chart, we see clearly that those who experienced recurrence of complex partial seizures were at least half in the group who underwent early surgery, and there will be at least 1/3 less than the group who didn't undergo surgery when it comes to simple partial seizures, who just only experiencing an aura. So the frequency of complex partial seizures was reported in the surgery group as half of what was reported in the patients who didn't undergo surgery. This is very good news for you, because this means the likelihood of you having less frequency of complex partial seizures after the surgery is at least twice compared if you kept on going with multiple drug medications. Also, seizures seem to lower the simple partial seizures by 1/3. The quality of life over 1 period was determined by how many people go for school and go for your daily work compared between the 2 groups, those who underwent early surgery and those who didn't. Clearly, those who underwent surgery were more likely to go back to work or study compared to those who didn't. and this again shows that surgery was beneficial in terms of quality of life. However, we have to tell you that there is a side down about surgery which you should consider carefully. It has been reported that half of those who underwent surgery for epilepsy suffered from some decline in their memory function and sometimes a small visual field defect. However, the likelihood of this to really affect your daily function is very low. Again, we will carefully weigh the risks and benefits of surgery, and we will always determine what are the potential functions to be lost and whether this would likely result in a worse quality of life, because this is the most important thing for us, your quality of life. There are even less common complications after surgery which we should tell you about. You could have an infection which would be treated with antibiotics. However, the likelihood of this are very low because of the very good sterile environment that we use in surgery. There is also a 1% risk or even less of having a bleeding complication. This is unlikely to occur, but if it did happen, it could result in a permanent neurological deficit that could be disabling. But again, this is a very low risk of 1% or even less. However, you have to understand that even though there is a risk of 1% of having a stroke that could result in permanent neurological damage, the risk of having neurological damage because of multiple falls, because of the uncontrolled seizures over a period of 5 to 10 years is actually 2%. Therefore, this is considered as larger than the risk of a bleeding complication during surgery, and therefore the benefit of the surgery is clearly demonstrated in this slide. In conclusion, we would like to thank you for taking time to listen to this video, and you are always encouraged to contact us by email, or you can ask any questions and talk with your epilepsy agency or family doctor. Remember, before considering this option, we will always try multiple drug regimens to control your seizures, and if all failed, then the option will be offered. We will always test you before surgery, and the option will be considered only if we believe the benefits outweigh the risks. Thank you very much.